Welcome, beautiful yogis. Today we are going to focus on helping relieve some lower back discomfort. Now, you and I are going to go through some poses that I have done this week that have actually helped me personally. Kind of did something at training and it triggered my back. The back's not the issue, it's actually the hip flexors, the groin, and the inner thighs, which is then yanking on the back. So you will need props. They're going to really help you, especially if you are in quite a lot of discomfort. Actually getting to the floor is going to be quite challenging. So blocks, props are going to be your friend. So I have a firm pillow here. If you don't have that, you can grab 2 pillows, a couple of cushions, something that's a little bit more firm so that you're able to support your body weight. If you have a bolster, even better. Now I've got 2 blocks. If you don't have blocks, you can use like a big cookbook or maybe some reading material, something that you can use. Okay, so normally we start standing, but today, because we are focusing on the lower back, we're going to start in child's pose. So it's going to be super chill. We're going to hold our poses to give the body time to release. Your breath is your number one focus. All right, so let's begin. Let me just move my props out of the way. Now, if you need to grab your props, pause the video and let's get started. Now, again, you will move as you need to. Do not overexert yourself, especially with that lower back. As that starts to release, things will get easier, but always, always listen to your body. So with your cushion, you're gonna place it between your legs. Again, if you have a bolster, this will be much easier. And you're going to come down into a position that feels comfortable for you. So as you can see, my bum is all the way back. Earlier this week, that was absolutely impossible. So you're going to come to a position where you can rest your head, drop your shoulders, and then come into a position that allows you to rest here. So if you don't have a cushion, it's also completely fine. We're going to adjust and modify. All right, so relax here and breathe. Good. Now, keep in mind as we go through this practice today, it's not about forcing the flexibility. It's not trying to rush through the pain or discomfort. It's about really tuning in. Yes, we all know pain is very uncomfortable, but it is, to put it bluntly, your body's trying to tell you something. And if you're not listening, pain's usually a really good way for us to listen. So as you're resting here in your child's pose, try to deepen the breath. Nice big inhale. And nice slow exhale. And just keep that rhythm going. We are moving intentionally, and we're also breathing intentionally. A few more breaths.
So as we begin today, it is important not to judge or condemn your body, especially when there is discomfort. Try to stay neutral. Try not to get pulled into the pain level that you might be experiencing. Yes, it is easier said than done, but it's not impossible. So, as I just mentioned, the body is communicating to you. There is something on a deeper level that needs to be addressed. And physical pain is often the result of suppressed, subconscious thoughts and feelings and emotions. Okay, that mind-body connection. Let's take one more deep breath here. And breathe out. Okay, we are moving intentionally, so slowly come up. Take your time. Again, depending on the discomfort you're feeling, it depends on how quick you move. So slowly bring those knees underneath your hips. So we're going to do a few rounds of your cat-cows. So inhale, chin to ceiling, shoulders back. Exhale, rounding. Good, breathe. Focusing on that deep inhale. Chin to sky. Chin to chest. Okay, so as we start to move around, feel free to move in a way that stretches you out. It's not just a linear cat-cow. You're tucking the chin in. You're lifting the chin up. You might want to roll a little side to side to get a little bit more through the obliques and your glutes and potentially sciatica. And real big focus today will be those hip flexors and your iliopsoas and the iliacus. They're deep hip flexor muscles. They start in your abdomen and they go down through the hips and they wrap around into your lower back. Right, so the deep muscles, often they are the culprits. Not always, but often when they're tight, they start yanking on other things. Take a few more breaths here. The key is not to be fearful. It's just listening to your body and breathing through that discomfort. Two more breaths. Very good. Okay, so I'm going to come facing forward. You can stay as you are. I'm going to bring that in front of me again. So just to show you, we're going to work through that groin inner thigh. So take one of your legs out to the side. From here, just like in child's pose, you'll either come down onto the forearms. Again, this is optional to use your props. You can have your arms resting onto the mat. As you can see, I'm resting my head onto my hands. And we are gently going to rock back and forward. Now, the toes at the back can be tucked under. They can be relaxed. You are only going to move to the range that feels okay. We're going to stay here for a little while. Breathe into your pose. Good. Try to relax your shoulders. Now, as you can see, I'm all the way sat back, but if your back is quite tight, you are more than likely going to be in a higher up position. and rocking back and forward. Breathe. So those lateral movements help to, again, target those hip flexors. You can feel this all the way through that groin. And hopefully up your back as well. Patience here, just keep breathing. Patience. A few more breaths. Good. Let's take a final breath here. We're going to slowly come back up onto the hands. If you've come down to the forearm, bring that extended leg back to center. We're going to do a few hip circles. One direction, then change directions. So using your breath will help you to keep the muscles relaxed as well. If you're holding your breath, more than likely you're tensing. Let's take the other leg out to the side. Now you might be surprised when often you've got pain on one side, you think, oh, it's only on that side. But more often than not, the site of pain is not where, more often than not, again, we can't call everything a spade, right? It's never just black and white. Sometimes it's elsewhere. Okay. So again, come into a position where you're able to relax and you're rocking back and forward. Breathe. So lower back tension, very common. Pain from sitting down for long periods of time. I've been saying this a lot in my classes recently. We are so sedentary without realizing, because you know, people say, oh, well, I'm getting old. Well, actually, no, we sit a lot more. Kids are always jumping around, moving, going from place to here, rolling around, doing something. We just don't move as much as we used to. So you use it or you lose it. So again, it's just sitting for long periods of time, not stretching enough, also being dehydrated. All these factors come into play. Back is very much related to feeling supported. So if you're in a time of transition or about to go into a big life change, usually the back is something that's like, hey, a little bit, you know, the fear comes up, do something maybe out of the ordinary or sudden, and the back goes. Keep breathing. Few more breaths. Be patient, be kind, be neutral. This is very important. The more you think, oh my God, this is so painful, this is so hard, this is not going to recover, you will prolong your recovery. And you sort of need a bit of military mindset, you need a little bit of athlete mindset here to overcome discomfort. It will pass. Let's slowly come back to center. Keep breathing, and let's do our hip circles. And change directions. Good. Okay, depending on how your back feels, you're either going to come into a kneeling position. If that is too much for you to come all the way back, again, this will just depend on your back. You can take the pillow or the bolster. You can place it underneath your thighs, or the blocks for me are a little bit higher. Again, you can use whatever props you have, and sometimes it's a bit easier, especially if your ankles and knees are a bit tight. Okay, so as much as you can sit upright, close your eyes. We're going to do some shoulder rolls. Now you can do this with your arms hanging down. So I want you to feel, or you can do this with your elbows bent. You can open the eyes and have a look and then close them back. So closing off the eyes allows you to go into the feeling more than into the thinking. So big shoulder rolls, keep the posture tall, keep those airways open. And let's change directions. Nice work. Okay, let's come back to center, release, shake them out. So chin to chest. You're gonna roll the head to one shoulder, back to your sternum, and then over to the other side. And let's do this a few rounds. So back to center, over the other side, back to center, over the other side. So just like a pendulum, let your head be heavy and increasing the range as feels good for you. Breathe. Let's do a couple more each way. And once you're done, slowly make your way back to center. Okay, so you might need to move. We're going to use the wall as a variation. You don't have to use the wall if, again, where you are, it doesn't work. So remove your props. Take your time. Now, if you don't have a space where you can use the wall, that's okay. I'm going to show you another variation as well. So option one, you're going to have your back to the wall. So again, this is for a bit more support depending on how uncomfortable your back is. If your hamstring is really tight, you're going to bend that knee. So you're going to reach over towards the ankle. So again, depending on how sore you are, you're either going to extend down or grab a hold of that foot. You're going to reach the arm up and just extend it to the point where you feel that stretch. Now I want you to breathe. Now, if you don't have the wall and you sort of feel okay seated, again, you can sit on a cushion or a prop, reach up and just breathe, reaching to feel the stretch all the way down the side of the body. Keep breathing. Less focus on the depth of the pose, more focus on the depth of your breath. A few more breaths here. Next inhale, slowly come up. Exhale, release. All right, let me move everything to the side. Slowly change your legs over. Okay, if you're against the wall, should feel a bit easier. Take your time. Okay, so sitting up nice and tall, reach the arm to the sky and find the range that you can hold. You can breathe first and foremost, and then as things start to feel more comfortable, you go deeper into your pose. A few more breaths. And slowly inhale, come up. Exhale, release. Okay, let's bring those legs out in front. Give them a bit of a shake out to release. Up, down, side to side. All right, just take a few moments, let your nervous system settle, which is what I've found this week. We're going to come onto all fours again, and from here, we're going to lift up into downward facing dog. Now again, depending on your back pain, I'm going to use my blocks because that's helping. The extra height is going to help. If the floor is too much, blocks are too much, and you have a sofa in front of you and you can put your hands onto the sofa, I would suggest that, as long as it doesn't go sliding off. So tuck that tailbone under. You might need to lift one knee up and then the other. If you can, you lift up both. It doesn't matter. Let's stretch it out first in down dog. Now, really be gentle here. We are working all the way down the back of the body. So allow your head to hang as I adjust all my clothing. Good. Lengthen the heels down. You might even find one leg is tighter than the other, which is completely normal. And that will start to show you that there's more going on with your body than just your lower back here. Feel free to move your hips side to side. And intentional breaths, intentional movement, and stay neutral with the discomfort that arises. Good, take one more breath. And let's drop the knees down slowly. Again, you might need to drop one before the other. From here, be gentle. Bring one leg outside of your hand. Take your time with that movement. Once you're in your position, drop those hips forward. Open the chest. Now you might need, again, this is quite intense to be forward and down. You might need to be up here, and this is going to be your position. There's no right, there's no wrong. It's just what aligns for you. So if that is the case, that this is where your back feels more comfortable, tuck that tailbone under, keep the chest tall, and your hands can be onto your hips and just hold that position. If you would also like, you can use the wall to help you balance. So now we're getting into those hip flexors, which I was talking about earlier. Your psoas, your iliacus, into the groin here and working down into the tops of the thighs. So be mindful that if you're leaning forward and your bum's sticking out, you're actually, let me just change legs to show you, you're actually missing out on this extension here, which is what we want to open up and lengthen. So if you sit back, you're not going to quite get that. So lift the chest
and tuck that tailbone under. Again, if you're able to sink forward and down, there's no back pain, just go to your level. Okay, we're gonna hold that position. I wanna come down onto those blocks and stretch it out. Breathe. Be mindful you don't tense your thighs. You're also not clenching your teeth. There's a lot more information coming out now about the connection with your TMJ, your jaw, and hip tension. A lot more information is becoming mainstream. Keep breathing, you're doing great. We've got 5 more breaths here. Okay, once you're done, it'll be a little bit sticky to come out of it. Slowly release. If you're a bit more upright, then just slowly bring that knee back and change your legs over. Okay. All right, so either you're upright, use the wall if you like, or something else that you can balance on. Tuck the tailbone under and come into your low lunge. Breathe. Now, if you are starting to feel like things are moving and releasing, great. Do this class as often as you need to, maybe once, twice a day, so maybe morning and evening. You will be at your stiffest in the morning, and maybe before you go back to bed at night. And if that's too much for you, see if you can at least try and get this in about 3 to 4 times a week. Key is to keep moving and to rest. Rest is important, especially if there's any nerves being pressed on or disc issues. And as with all movement, make sure that you have clearance from your physio, from your GP, to ensure that you are moving safely. And sometimes it's hard to know, do I move more? Do I move less? Once you start connecting with your intuition, your body will really tell you. It's when you first start listening to it that is the challenge. Am I doing this right? Am I doing this wrong? Is pain a good thing? Can't avoid pain completely, but there is a fine line with that good pain. You're like, yeah, I've worked. Okay, this is feeling better. And then the other one where it's like, this doesn't feel so great. Something's not right. That's the one where we have to be mindful of. Okay, a couple more breaths. Okay, slowly come up out of your position. And we're going to come into one more child's pose. Take your time. Again, all intentional. And come into a variation that feels okay for your back. Just make sure your head's resting. And as things start to release, if it feels more comfortable, you can sit further back. Breathe. Now, I have found those low lunges quite beneficial for me. See how you go. Let me know in the comments below how this helps you once you finish your practice. Okay, so we have one more pose to go. It is going to be a very gentle back exercise. If you're not able to come onto your back, then come into a standing position with your back against the wall. So let me demonstrate first. Hopefully I'm still, if my head chops off, it chops off. So once you're up to stand, if you can't lie on your back, because it's a bit uncomfortable to get there, what I'm gonna get you to do is you're gonna stand close to the wall. You're gonna press your back, your lower back into the wall. So there is very little space between your hand, the wall, your hand and your back, and draw that chest back. You might need to bend your knees for this one, just to give that bit of stability there. Okay, now if you're able to come onto your back, do so. Bend your knees and bring one knee towards your armpit. You're either going to come into single happy baby. Now you don't have to grab your foot. That's available to me. Maybe your ankle, maybe the shin bone, maybe the back of the leg. Okay, and if it feels okay, you're going to gently rock side to side. So if you're standing, just keep pressing that back into the mat, into the wall, and make sure your head doesn't come forward. You're pressing as much of you into the wall as you can. And what that's doing is helping to activate your pelvic floor and get your hips back into a bit more of an alignment. So if you are standing, look at your feet and see if they're even. So you haven't got one foot in front of the other. If they're not, bring them into alignment. Keep breathing. All right, let's change sides. So single leg, happy baby. Okay. So my left side is definitely my tender side. I feel like someone's got their fingers dug into my hips and just yanking at it. That's what it feels like. And it's all coming through my hip flexor and it goes right into the groin. So interesting. I find the body very fascinating. How tension works, how strength builds. All very fascinating. Okay, couple more breaths. Okay, so once you complete your last two breaths, if you're standing, I want you to just come into a comfortable position, whether you want to stay standing or if you can come back into one more child's pose, do so. Now, if you're on your back, we're going to stay here. Close your eyes. Just let everything settle. Make sure your back is relaxed here. You're not tensing it. You're trying to let it go. And if you are lying down on your back, just tuck that tailbone under just a little bit more. And relax your shoulders. Okay, we're going to do a little visualization exercise to finish off the practice today. So as you're breathing in cool, calming waters. And as you breathe out, it draws out the tension, the stiffness, any fears, any emotions that come up with any of your poses, or even just now. Let all of that be washed away with these cool, calming waters. Keep visualizing. Just imagine a gentle stream. It's cool, it's calm, it's flowing, and just cleanses with it as it continues to move through you, takes with it toxins. If anything's been placed in you, that you've had a procedure done, maybe something's impacted you with an injury, just feel all that just being washed away gently and slowly with these cool, calm waters. Soothing all the areas of discomfort and soothing all of the fears, the doubts, just soothing them. The frustration. And often when we have pain, we feel a little out of control. So just allow that to flow. Sometimes it's forced rest. We wouldn't stop otherwise, we wouldn't listen otherwise. Maybe an inconvenience, but in the long term, there is something to be taken from this discomfort. Just allow those waters to continue to cleanse and heal and repair your body. Knowing that all is being done to bring you back into a high vibration, that all is being done to bring your body into harmony and into balance. And that all is well. Thank you for joining me. My name is Theodora. I wish you the most amazing morning, day, evening ahead, and know you are a truly divine being. All is well. Till next time, thank you and namaste.